In the previous episode.
So what are some immune-supporting herbs? There's some of these that are used as food that are really good for, can you just put into soups and stir fries? Artichoke. Artichoke is really good immune system support. It supports the liver as well. So artichoke leaf especially, so that's the part that we generally don't eat, but those can be put into a pot and added to a soup. We've got burdock. Burdock looks like a potato that is the shape of a carrot. It has that outside brown kind of a skin that we can wash off really well. But burdock root is an amazing immune support. And it also, again, supports the liver.
Welcome to Reinvent Healthcare, a podcast for health and wellness practitioners passionately committed to transforming our current broken, disease-focused system. Your host, Dr. Rita Marie Los-Calzo, is devoted to helping you get results with complex health challenges like autoimmune, hormonal imbalances, and chronic health challenges caused by nutritional and lifestyle-induced imbalances. Here's your host, Dr. Rita Marie.
Welcome back to Reinvent Healthcare, the podcast for health and wellness practitioners who are passionate about making a difference. On today's episode, we're going to explore the relationship between food and female hormones. In dealing with the female hormone imbalances that occur with hot flashes and other uncomfortable symptoms many women experience in menopause, with PMS, dysmenorrhea, fibroids, and other syndromes, most doctors prescribe hormones, or they put women on antidepressants or other drugs for symptom relief, or they tell their patients to just learn to live with it. Today's special guest, Dr. Anna Cabeca, is here to share other possibilities related to teaching patients how to eat properly for hormone balance. As holistic and functional practitioners, you owe it to your clients to learn how food affects hormones and to learn strategies for empowering them to make the diet and lifestyle changes that can reverse the uncomfortable symptoms of female hormones gone awry. Our guest today knows this firsthand. She has actually been through menopause twice, had a baby in between, and she knows well the discomforts that accompany hitting that transition with hormones out of whack. So let me tell you a little bit about Dr. Anna Cabeca. She's triple board certified and a fellow of gynecology and obstetrics, integrative medicine, and anti-aging and regenerative medicine. She has special certifications in functional medicine, sexual health, and bioidentical hormone replacement therapy. For the past 20 years, she's served over 10,000 women in her private practice and millions more through her books, online videos, and articles. When her own health took a troubling turn for the worst during menopause, she sought the wisdom of healers around the world. And she learned that modern medicine and time-tested natural remedies are not at odds. So working together, they create indisputable results and true well-being. Using delicious healing foods and simple lifestyle changes, Dr. Anna reclaimed her own health and life. And fueled by her own belief that every woman deserves to be empowered and in control of their health and life, she developed what she now calls the Keto Green Lifestyle, which has helped thousands of women to use the power of food to opt out of menopause misery and experience a joyful transition to the next stage of their lives. Dr. Anna, thank you so much for being here.
Dr. Rita Marie, it's always a pleasure to chat with you.
I love it. I love where we go with this too. And I love geeking out on the science and also the natural, basic common sense wisdom that we always impart to our clients.
It's the common sense, right? It's what can we do on a daily basis that's going to make the biggest difference. And we think, academia does not mean common sense. That is for sure.
That's for sure, right? And it's putting the two and two together. This is what I always struggle with when I see how conventional practitioners are taught to practice, is that here's all the science and here's a drug to cover it up. Like, wait a minute, what about all those things that you can intervene with, that you can help people and empower them to take charge of? We don't want to just cover it up because, it's like if you're bleeding and you cover it up with a Band-Aid, you're still bleeding if you don't fix what caused you to bleed? And that, I think, is what happens here at menopause and with dysmenorrhea and all the other stages of menstrual hell sometimes.
It absolutely is true. And I think about this from my firsthand experience with my mom. Like early on, I got into this because my, women's health, because I recognized that the treatment my mom was undergoing was performed only on men. And by the time of her premature death at a young age of 67, she was on 11 prescription medications, no two of which were ever studied in one person. And so this is a top-down approach to medicine where you're just symptom treating and you're treating side effects of prescriptions that are being prescribed to treat symptoms. And so it's very aggravating. And that's why I really made it my mission to get to the underlying root cause, to get to at the cellular level. If I can improve cellular function and cell-to-cell communication at the microscopic level, the nanoscopic level, then I'm creating health in the largest, fastest way possible.
I love that. And I love that for a couple of reasons. But one is that when we think about food, right? People think about food. They think of it as an adjunct. It's just this fruit. Oh yeah, food might affect, but what are the real things that we can affect? But when you say affecting cell-to-cell communication, to look at it at that nano level, that's what food is, as it supplies the body with messages to do what it's supposed to do, as opposed to what it's been taught to do by, I don't know, dysregulation or dysregulation. Yeah.
And actually, Rita Marie, I'm just speaking in France in May, at the end of May 30th or 31st, and I'm speaking at the Women in Tech World Summit. And one of the panel I'm on with amazing individuals is about the food chain, about setting the table for 1 billion people, for instance, and food scarcity. And one of the members from the World Bank, Gita Sidhu, I believe is her last name, if I'm pronouncing it correctly. And she said, we have been addressing caloric sufficiency versus nutrient efficiency. And that's a problem with our food chain. I think that's so true. But focusing on calories and not what nutrients our body needs and what messages those are sending. And so food is critically important, and also changing the lifestyle that's been destructive. The 3 meals, the 3 snacks. I think of our kids at school, they're taught, have breakfast, have a snack, have lunch, have a snack, and you're on your own. But that's like a culture that we have to change. We have to change, make it 2-3 meals a day. Especially because as we get older, we naturally become more insulin resistant. So we have to fight that. So I love that quote that she said, caloric sufficiency versus nutrient efficiency.
I love that. And I also love that you and I focus on food for nutrients versus, how do we isolate this and turn it into a supplement? And don't get me wrong, we both believe in supplements and using it as supplements to a good diet. But that's a place where I think we get reductionistic in our mentality, right? We're holistic practitioners, we're functional practitioners. So now we give somebody 12 bottles of vitamins to take instead of the 3 prescriptions that they were taking before, and think we've made huge strides.
Well, there are huge strides there, but you can't get anywhere without the right food and preparing the environment for that food to be received. So digestion, right? Detoxification. What comes in must go out. Elimination. So, and I was that physician too, Dr. Rita Marie. I mean, especially the more I learned, and I did testing, and I was big into organic acids and look at every cellular function, Krebs cycle and on. And I remember one time I was like, okay, I had this client, I had all these supplements, and it came up to over $200 or $300 for the supplements. And I sat back and I said, well, what if we, the best 2, let's just start with the 2 that I think is going to be the biggest game changing for you. And I started there, and from there on it went, I really did whittle that down. But I just realized that, okay, well, wait, first of all, it doesn't matter how many nutrients we're putting on board if the digestion's messed up, if the, gut bacteria, the intestinal bacteria, microbiome, if that's messed up, if we don't have digestive enzymes, if that's messed up, addressing those issues. And that is critically important for hormone absorption and detoxification and utilization. And so my pendulum swung too.
It's interesting. Yes. We don't just go from being a conventional practitioner to being a holistic practitioner by swapping out the medications for the supplements. We do that on a much deeper level when we're working at people to affect change in their behaviors and their foods and all that. So given all that, right? So there are some foods that probably are contributing when we see somebody who's having miserable menopause and symptomatic and can't sleep and is sweaty and all. There's some foods that contribute to that. I think that on a global level, from a societal level, but then individual levels. Can you address that a little bit?
Yeah, there absolutely are. And I think that's where we're getting into the carbohydrates. And the biggest food that I see women doing wrong in menopause are those fruits. Those fruits that we love, and it is pure sugar. And so that's really something to be conscientious of. It's not that they're going for the bagel or the muffin or the cookies. There may be that, but it's we think we're doing something right by making these fruit juices or these juice smoothies or fruit smoothies. And, we have to think about that too. Like, okay, there's healthy information that we're going to get, but a little bit goes a long way in this picture. And then the unhealthy aspect of the rise in blood sugar. And if we don't need it, right? If we don't need it, there's certainly times when we do. But if we don't, then it's also creating this more insulin resistance can be very damaging to our physiology and our, create disease. And one of the things that, as you were talking, I reflected on certainly my journey as a physician and hormone expert and prescribing bioidentical hormones. And what I had realized with my own journey was that it really takes more than hormones to fix our hormones. And through that, that's where the food as medicine really hit home for me and creating what I call my keto green way of eating and the lifestyle that goes with it. So even if we can't afford additional supplementation, the strategies through what we eat, when we eat it, even who we're eating with, right? If we, different things like that, if we're stressed versus relaxed and grateful, that all affects how our body will absorb our food. And that's amazing. So things we can do that are very low cost. But I would say sometimes it's the healthy things that women are doing, trying to improve their health that are actually destructive. And that would be, too much fruits. And that would be snacking. And for most of us who aren't at our ideal body weight, that can be detrimental.
Yeah. And you keep talking about insulin resistance and all. So can you just share with our audience, so they're working with clients who are in menopause, they're maybe dysmenorrheic, maybe they're infertile, trying to get pregnant. How does insulin resistance impact the hormone, the female hormones in particular?
I think we're really still at a paucity to understand this because insulin affects the ovaries. It affects the ovaries in so many ways. We know women with polycystic ovarian syndrome have insulin resistance. Is it the insulin resistance that causes the polycystic ovarian syndrome or vice versa? I would suggest the former. However, we still have to look at all the ways that insulin affects our ovaries and our ovaries are communicating. Our recent study looked at women who had had hysterectomies, and we know that for diabetes, menopause is a risk factor for diabetes. Well, I didn't know that, but it is. Menopause is a risk factor for diabetes. Your risk increases significantly at menopause. And if you've had a hysterectomy, your risk is even higher. And if you've had a hysterectomy with your ovaries removed, we call that bilateral salpingo ovarectomy, your risk is even higher. So is it the fact that removing the ovaries increases your risk for diabetes? Or is it all tied into this insulin resistance causing dysfunctional uterine blood flow and ovarian production of hormones? So it's still the chicken versus the egg phenomena right here, Dr. Rita Marie. But I love thinking about it.
Yeah, I know. It's always that issue. So what you've found, so let's look at, there's the science, there's the studies, so you can look at biochemical pathways, then you can look at studies, and they don't always, are not always prepared properly, so let's just say, and sometimes there's bias when the study is being created that you want to have a certain outcome, and you can create the study to look that way. So you can't always trust studies. But what about your clinical experience with working with women who you change the diet? Let's just see. It's inexpensive. It may be a little painful for them at first, but you get them to change their diet. What are the effects you're seeing?
Yeah, this is so critically important. This is where I see the most rapid change, the quickest possible. And it's certainly not where I was trained. And in fact, in our medical school systems, for at least, in the residency and the school I was in, it says, you have to look at evidence-based randomized controlled trials. And if someone says, in my clinical experience, really have to question that individual. The opposite, in my opinion, has to be true. I think that was brainwashing in the negative, because you have to trust your clinical experience. So for all the practitioners listening, trust your intuition. What do you know to be true right now? What is working in front of you versus what is not working? I mean, how many times have I, operated on a patient or prescribed something and needed to do something else as a result of that? I mean, we really have to think, okay, clinically, what works? And so when I started through my own journey, reversing my early menopause, et cetera, and brought those practices into my medical practice, which did include the supplement that I created called Mighty Maca Plus. In my opinion, that is a foundational support for our adrenals. And as superfood combinations, 30 superfoods plus maca. So it is, so in using like this system with my clients, say, for example, I had a 57-year-old female coming in with continued hot flashes, pre-diabetic at this point with a hemoglobin A1C. I think anything over a 5.5 is pre-diabetic. Technically, it's a 6, but you guys listening, you need to think of it as a 5.5.
Anything over 5.2, I think, is problem. So
it is a problem. It is a problem. Yes. Yeah. Absolutely. Yeah. And then that just classification pre-diabetes, but it is absolutely, we want to get it optimal. You'll be proud of me, Rita Marie, even within book launch stress, my hemoglobin A1C is 5.0, so I'm pretty happy.
Woohoo!
So I know, it is good. And so with diabetes on both sides of my family, and at one time a hemoglobin A1C of 5.7, so you guys, this is a big deal. And so with that to say that, and I incorporate, clients coming in and doing like the keto green plan, which I call a keto green plan, supporting with maybe without any additional, but I would, if I was seeing them in person, add in detoxification support. That's my keto green detox. I would add in Mighty Maca Plus to support the adrenals and alkalinity, especially as we start fasting and carb restricting. Getting into ketosis is very acidifying, so we need the alkalinizers on board. I see game-changing results, like 80% improvement within 2 weeks in symptom scores. And this is, taking this online, as you have taking this online into my client population, I'm seeing that over and over again. And then I see where things stop working and we hit a block, a roadblock, right?
Yep.
Plateau. Yep. And that's where I created my 5 plans to bust through the plateau, 5 6-day plans. And now that the book's been out, a short amount of time, I'm just reading all the testimonials. I mean, I knew it would work, but I am blown away by how much it's working and how fast it's working for people who were stuck. This one woman wrote in, I just read her testimonial on Amazon. I don't know her. And she wrote that in 6 days, she lost 5 pounds, and she did the carb modification plan, and she had been stuck for years at trying everything and had been stuck at her weight. And she totally moved the needle. And not only did she lose those 5 pounds, but she feels better than she has in forever. And that just is game changing. I knew this is a pause. And then we decide, okay, what's my next pause going to be? Or am I going to stay with this pause because I feel so amazing? And then when that stops working, we have to switch again. We have to keep changing things up, Rita Marie. And that's what I found through my practice in food as medicine. That's true with supplementation too. There's true with, with hormonal management. It's not one size all the time.
So the book we're talking about here is Dr. Anna's latest book, which is called MenuPause. Play on the word menopause, right? And it's lovely because it's recipes and food guidelines for people to follow, and it's not a religion. Because I always like to call the religions, this religion is this way and you eat this way. No, everybody gets to choose. And there's a bunch of different menus that people can cycle through. But I want to get back to one thing before that you said, and I just want to clarify. You had said that you think a lot of the symptoms women that you're seeing are experiencing in menopause are related to the excess fruit consumption. But I want to go backwards from there because a lot of the folks that you're seeing are educated and they're trying to, eat more fruits and vegetables and less of the crap.
Right.
But realistically, when women hit that age, it's because they've had a junky diet up until then, usually, right? There's too many carbs in the ways of the bagels and the breads that a more educated person may be already off of.
Or the rice,
sugar,
or the rice. Healthy, the quinoa. I mean, there's like, we can be doing everything right. We hit this menopause and everything we knew to be right, but it stops working. We're eating the alkalinizers, the grains, the nutritious foods, and we're the whole wheat. We don't eat wheat, but anyway, you know what I'm saying. We're trying to think, okay, I'm making the better, healthier choice, or I'm eating the gluten-free snacks or whatever it may be. And it's like we have to completely revamp. We have to intermittent fast 13 to 16 hours between dinner and breakfast. We have to stop the snacking and allow our body to fully digest before it is assaulted with another food to
the assault
eat.
of the fork.
The assault of the fork. It's coming for you. And it doesn't give your body a chance to digest fully. Oh my gosh, Rita Marie, I love Instagram. I'm on Instagram at The Girlfriend Doctor. And I did this just funny video, this reel. And I said, are you making this mistake? And I poured water on my dinner, and I'm going to do another one to follow up on this one. But it's gone hugely viral, and people were asking, I didn't realize that if I drank with my meal, I would be diluting my enzymes. That makes perfect sense. And the comments have come in. And so, it was really fascinating because I take for granted that when I learn something, everyone else has learned it too.
Yeah.
And this is something so critically important. Like, okay, stop 20 minutes before, begin 1 to 2 hours after, no more than 4 ounces with your food, and chew your food till it dissolves in your mouth. That's critically important lesson. So I think that was really great, eye-opening.
I love it. I can just picture it. I'll have to go check out your little video.
Yeah, you have to check it out.
The visual of that is like, oh, is that what I'm doing? And you're sitting there going, that doesn't look so appealing. But, but that goes back to what we said initially is the common sense pieces, right? What is the common sense that people go, oh, yeah, hydration, just hydration in general, let alone the when to drink the water. And it's simple, yet people are not doing it. So we have to take them back down to basics. So some of the foods that you're finding have the most impact on the female hormone system and the dysregulation are the carbs. Is that what I'm hearing?
Yeah, it's the carbs.
Okay. And what about folks who say, I'll throw this out to you because I've never had a good answer for it, but no, it's the insulin dysregulation happens when the insulin receptors get damaged by fat. And all we have to do is go on a low fat diet with lots of carbs. It's not the carbs, it's the fat.
Well, we would call that fasting in my world.
Well, no
clean
carbs.
Up your receptor sites. Yeah,
clean up the receptor sites.
We'll clean up the receptor sites with some really low carb, low fat, low everything. Right? Let's just fast.
There you go.
And that's where fasting really helps. And by design, that's critically important. Fat is essential for hormone production. I've been following certainly my labs now very regularly, and many of my clients' labs. And I see an improvement in cholesterol. I see an improvement in energy and hormone balance and cognition in life. And it's just amazing. Like, as you've seen in your community and with your practitioners, and, you see a difference. You see a visible difference, an energetic difference. And that's the key thing. We want to vibrate at the highest vibration we can. And so the energy that we're consuming, the energy that our body is making has to come from a place of being really well healed, really solid, really good communicators. And I keep saying communicators because to me, communication is medicinal. Communication is life-saving. It's anti-aging in so many ways. And at the end of the day, it's our relationships, love and connection that make the day worth living. And so, but it also comes down to cell-to-cell communication. When we heal cell-to-cell communication, they interact well, and then they affect each other positively. So when there is a abnormal cell that's metastasizing, a healthy cell will turn that other cell off, will help close that gap, so to speak, close the gate. But when you don't, you have metastasis occurring. So communication, that's how important it is at the cellular level and in every level of our lives.
Awesome. Communication, right? That's a big problem in marriages. It's a big problem in relationships at work. I mean, lack of communication. Of course, why not expect that that's going to be a problem in the body and in the regulation of the hormones and the glands and everything else that's working together. So I love that clarification. And I also have a couple of more specific kind of things you've mentioned along the way. So I'm going to ask you a couple of key questions. One, you've talked keto green, and a lot of folks may not be familiar with that term, so I'd love you to explain it. Because when people think of keto, they're thinking of sitting down and eating butter and bacon all day long, lots and lots of fat, and not a lot of green things that are green. So tell us what keto green is.
Right. And that's where it's so true that the concept of keto has really been about that high fat diet and lots of meat, and that couldn't be farther from the truth. The goal of keto is to get your body into ketosis, to get your body to burn our fat, not the fat that we're consuming. And plus, the healthy way, I would say there's keto dirty and keto clean, which is keto green. And this is the healthy way of eating keto. And that makes the difference because we're adding the alkalinizers, because ketogenic foods and eating and fasting, all of those, increase acidity in your body. You will rob Peter to pay Paul. And that's why you see such a big push towards mineral supplements and mineral salts and things like that now in the keto community, because they're recognizing it. But we recognized it. Rita Marie, we had this conversation years ago talking about this. We have to have the alkalinizers on board. Plus, in every long living population, there's a significant amount of plant diversity that's part of the food chain. So it makes sense. And so adding the alkalinizers, the dark green leafies, the sprouts, the cruciferous vegetables for hormone detoxification, that's a critical piece to my meal preparations. And so that's the difference between keto green, because keto green is not just a diet, it's a lifestyle. It's eating, for example, a plate of smoked salmon with capers and red onions on a bed of arugula, doused with some olive oil and served with a side of avocado. I mean, completely different than bacon and butter, right?
Right.
Completely different. And the nutritional value, again, it's calories versus nutrition. So the nutritional value is tremendously higher in that case, assuming we can digest our food well.
Right. So it goes back to, in order to have healthy hormones, in order to be eating for your female hormone health, we need to have, number one, focus on digestion, chewing food, eating in a non-stressful environment, but also having the digestive mechanism in place, good microbiome. So all of those things need to be intact. And then looking at a keto green, meaning more of the green leafies and all those great vegetables that have so much nutrition with very little carbohydrate, very little starch, lowering the starches. And it doesn't mean zero, so I want to address that as well. And then good, whole, healthy fats. Is that kind of what sums up keto green?
Yeah, and the goal is to heal the metabolism, to heal the cellular function, right? To give healthy fats for a good, healthy cell membrane, and how important that is part of its healing, our healing journey. So, and then giving your body that time to rest and digest. And with the intermittent fasting, I think that is a component of being keto green in the healthiest way possible. And of course, I always say test, don't guess, because if we're not checking, for example, our urine pH and ketones, we may not realize how far off the mark or on the mark we actually are.
Right, right. So totally cool. So if we were looking at somebody, everybody likes to get it down to what specific foods should I tell people to eat for healthy menopause and healthy female cycles. What, in a nutshell, are those?
Oh my gosh! In a nutshell, I'm gonna give you some of my favorite foods, but I'm also gonna walk through my 5 plans in MenuPause because it can be different depending on what you've been doing and what your body's healing from or going through at this moment. So some of my favorite foods are like actually just had bison, my Georgia buffalo bison shepherd's pie. So I made it with bison meat, onions, garlic, small amount of carrot and cabbage, and then my mashed potato topping is actually mashed cauliflower with celery root topping. So all, supporting phase 1 and phase 2 detoxification, high quality fats, a lot of alkalinizers and cruciferous vegetables. So in that one meal, I've combined it all. And that's how I think now. And that's how I want my clients to think. It's like what combines it. So that's one. I love smoked salmon. I love oysters. Olive oil is by far my favorite oil. And I love, I'm going to say I love my Mighty Maca Plus supplement. I love my adaptogenic supplement. I mean, I do it pretty much every day. And so that's kind of my food love, that I love this stuff. And, I'm a foodie in general, so I can go on and on and on because there's a hierarchy to food for sure, but I do not discriminate. I love food from around the world. And in fact, in my new book, MenuPause, I incorporated snippets of menopause around the world.
Nice. So it boils down to, right, good, healthy greens, the cruciferous vegetables, colorful things, and the good fats. Really, it has to be good fats, not like, saturated, processed stuff that's been, through the mill, like the can of Crisco or whatever, things like that, which I think people have thrown away a long time ago, although shockingly, some people still do those things. But good fats, balance of good fats, plus the lots and lots of green leafy vegetables and non-starchy stuff. And in terms of your menus, you talk about where does starches fit in? Where do things like quinoa or millet or rice or wild rice or things like that fit in? Or
those
do they?
Are in your carb up days. So, and I recognize too, Rita Marie, because you're a vegetarian. I mean, there's the challenge, and you do this really well. You've figured it out. But the challenge for so many of my vegetarians is too many carbs, is too much of the sugar. So, and the fruits and the grains, but there's a time and a place for it, especially when you've healed your metabolism like you have. So there's, but you're fighting your genetics too. So there's a time and a place for it. So there definitely is. And I think that it's not an all or none. It's a yes and. Sometimes I do this and sometimes I do that, but where am I at now? So for example, in MenuPause with the 5 different plans, they're all 6 days. So what do you do day 7? 7 could be a fasting day, could be a feasting day, could be a challenge day. Like, okay, I've eliminated this food. I feel great. What happens if I add it back in? It can be that exploration day. So when are we giving ourselves that, that leeway? And sometimes we can't give ourselves an inch because we'll take a yard. And sometimes if we don't give ourselves an inch, we're not doing it. Right. We're not doing it. So there's that play. And that's how I kind of feel with why I created 6-day plans instead of 7-day plans or
I love that.
Else. So
I love that because it is the flexibility. So we've talked about a lot. We've talked about, the foods that really balance the hormones sound like lots of green leafy vegetables, lots of cruciferous vegetables, the sprouts, the fermented cabbage and all those sorts of things that can be fermented, kimchi, sauerkraut, even making your own yogurts from nuts or seeds that have really good fat profiles can be really helpful. So all of these things that make sense just makes common sense, makes sense for female hormones. And then really keeping wraps on those carbs. And then I love the MenuPause idea of, trying different ones and seeing where do you feel better and do you cycle through them? How does that work, right? So I love that idea. So if we're going to leave our practitioners with a few action steps that they could take the next time they're sitting across the table or across the Zoom from someone in menopause struggling with hot flashes and can't sleep and irritability, what are the first few steps that you would give them to take with that person?
Yeah, I would just say implement one of the Keto Green plans. I mean, they're 6-day plans and they're attainable. That's a bite-sized plan, essentially. That's not going to feel overwhelming for the menopausal woman. And so it's not going to feel overwhelming when you give 6 days and say, okay, let me see how you feel. And you're doing great. Let's continue on, take a 7th day pause and continue on. Let's see how we can do with this. But I think it's choosing the right plan to work for them, maybe having to experience several of the plans before you figure, okay, this is the best one for now. And I think that's the key thing is like, okay, with that woman who crossed, she's overwhelmed. Giving her something like that, like one of the book MenuPause, one of the plans in there, it's definitely helpful. And saying, okay, and a few different things I want you to do. It's that basic, we're going to intermittent fast. We're going to focus on getting you a good night's sleep. You're going to start your day with gratitude practice, just thinking of things that make you laugh or make you feel grateful, that make you happy. Yeah. And those little things are just the lifestyle pieces that will profoundly increase their compliance in your recommendations because they'll have more energy to do so.
Yeah, that's awesome. That's awesome. So we have been speaking to Dr. Anna Cabeca, author of the brand new book called MenuPause and also author of Keto Green and the Hormone Fix. Is that what your first one was?
The Hormone Fix, yeah.
The Hormone Fix. Yeah. So you'll see her just visit the show notes page. You'll see links to all of her stuff on there, her complete bio. This has been really a great conversation because it's bringing it down to common sense plus science. And common sense plus science, I think, equals success. So as you guys work with your clients, the more you master using food, not even so much as medicine, but to circumvent the need for medicine, right? You're really using food for function, to establish that function, the proper function in the body. The better results you're going to get, the more success your clients are going to have with reaching their health and wellness goals. And guess what? That's what we're here for. That's why we dedicate our lives to doing what we do. And as a result, you're going to get people who are referring other people. You're going to have a fulfilling and thriving practice where you feel great at the end of every day because you're helping to change lives for the better. So remember to download the functional food guide that I've put together for you that has all kinds of great resources related to food. And it's at www.reinventhealthcare.com/food. And until next time, shine on.
Thank you for listening to the Reinvent Healthcare podcast. Join the movement of practitioners that are guiding people to actually get well rather than covering up their symptoms. Connect with us at reinventhealthcare.com to access resources and tools that will empower you to create a thriving health practice.